More than 65 million Americans will soon be bombarded with ads for Medicare healthcare plans, whose open enrollment period begins October 15th and runs through December 7th. Each year, Medicare health and drug plans can change. They change things like costs and coverages and what providers and pharmacists are in their networks. During the annual open enrollment period, people with Medicare, just like yourself, can change their health care plans and prescription drug coverages for the next year to better meet their needs, whether that's dictated by health changes, maybe you've moved, maybe your finances have changed, or maybe it's something else. The options, though, they seem endless, and that's part of the problem. You can choose the federal government's original Medicare and its supplements, or pick from a growing number of Medicare Advantage plans that are offered by private insurers that are approved by Medicare. Last year, nearly 4,000 Medicare Advantage plans were available nationwide, and according to the nonprofit organization KFF, which focuses on healthcare policy, the average Medicare beneficiary, just like yourself, could choose from over 43 different plans, which is more than double the average number that were available back in 2018. And it's the highest number since KFF has been tracking the options. That's part of the issue, that there's so many plans that are out there. No wonder, choosing a healthcare plan can feel, like it's overwhelming and confusing. But that's why we're here. Nevertheless, it's an important decision that if you don't do it right, it can definitely hit your budget hard, if you're not careful. With so much at stake, there's certain things that you really feel like you really need to know to make the right decision. So what is the difference between original Medicare and Medicare Advantage? We get that question a lot here at Market Medicare Advisors, and I'm going to take just a moment and break that down for you. Original Medicare includes Medicare Part A, which covers things like inpatient stays, care in a skilled nursing facility, hospice care, and there's some other home health care options that it also covers. Original Medicare Part B covers certain doctor services, outpatient care, medical supplies, preventive services, and other options as well, similar to those. You also have the option and ultimately the requirement to buy a Medicare Part D, a separate prescription drug plan that you must choose as soon as you begin receiving Medicare. If you wait, you may have to pay a penalty each month that goes on and on and on and on for the entire time that you're on Medicare. It doesn't go away. So, original Medicare, one of the things that people like about that is access to really any doctor or hospital that you want to go to. Almost all doctors and hospitals take Medicare in the U.S., and you usually don't require any type of referral or anything like that to see a specialist. There is also an option on original Medicare to purchase what they call a Medigap policy, or a supplemental coverage from a private insurer. Within 6 months of getting your original Medicare Part B, if you're 65 and older, you can purchase a supplement plan, and this plan will help defray some of those out-of-pocket costs, like the 20% co-insurance and some of the other deductibles that you might have to deal with. The supplement is a one-time enrollment, and if you don't buy it within that first 6 month window, you might not be able to get it later, and if you do, you're probably going to have to pay more for it. So definitely these choices make a lot of sense to make them when you need to. Medicare Advantage, also known as Part C, is basically a bundled plan. They bundle together Part A, Part B, and usually, not always, but usually Part D, the prescription coverage as well. Usually you have to use the doctors that are in the plan's network. The Medicare Advantage programs are typically HMO or PPO networks. Now, some of these plans have lower out-of-pocket costs than the original Medicare, but you have to be careful with that. A lot of plans offer, some extra benefits that original Medicare doesn't offer, like vision, hearing, and dental services. Some plans offer non-emergency coverages that are outside of the network, but typically if you go outside of that core PPO or HMO network, you're going to have a higher cost for some of those services. And you also will probably need to get a referral if you want to go see a specialist. A lot of people don't like that, so they opt for some other options. What if you do nothing during Medicare open enrollment? If you're satisfied with your healthcare plan, you don't really need to do anything. You'll automatically be enrolled as long as it's still offered, which that's a very important caveat. Only about 1/3 of all Medicare beneficiaries actually compare their plans during open enrollment period. We strongly encourage you, however, to review your coverages because plans often change, especially drug coverages, and you may end up paying more for the same medications that you took in 2023, but now they're going to cost more in 2024. And it never hurts to take a look to see what other plans have. We really strongly encourage that we sit down with you and make sure we take a look at the plans because we've seen some real nightmare scenarios. And the worst thing you could possibly do is simply ignore it and not even take an opportunity to look. You don't necessarily have to do anything if you like the plan, but if you don't look to see what else is available, you may be spending more or getting less coverages than what you need. But how do you know if you should change your Medicare plan? To determine if you should switch plans, we, like I said earlier, we certainly encourage you to review what you have and determine if it still suits you. There are 3 things, however, that you really should review because they often change. And we strongly encourage you to look at these 3 items as they make up your plan. Number 1 is drugs. What drugs are you taking? What are the dosages? And whether or not they're branded or they're generic drugs. And you need to see if your plan will still cover them and how much they'll cost. There's basically been some big changes, both with some drugs going down, some drugs dropping off the formulary, and some costing more. So you need to make sure you know what you're going to pay. Doctors, you need to review your doctors. You need to make sure, especially if you have an Advantage plan, that those doctors are going to still be in the network. That isn't necessary for traditional Medicare because most doctors and hospitals accept Medicare, but you do need to check to make sure that they're going to continue to take Medicare as well. You need to check your costs. You need to check premiums and out-of-pocket expenses, the maximums. Word to caution. A Medicare Advantage program, just because it has a 0 premium, doesn't mean that it's $0. These figures, you have to balance that out with what your out-of-pocket expenses might be, which may be higher than what's on a Medicare supplement plans that are used in original Medicare. We need to make sure you have a guide that is going to help you walk through these options and these premiums. Because I mentioned before, just because you have a 0 premium for Medicare Advantage, you still have to pay the Part B, which is $164 this year, and it's rumored to be going up to $170 plus a month for next year. You need to have somebody sit down with you who knows Medicare, who knows original Medicare, who knows Medicare Advantage, who knows which companies are the good companies that have good customer service, what the star ratings are based on past customer service surveys, which plans are due for increases in the near future. You really need to sit down with somebody like ourselves here at Market Medicare Advisors and make sure that you're being well taken care of, because the choices that you make or the choices that you ignore can have a big impact on your health going forward and how you manage your budget and your finances going forward as well. The last thing you want to do is continue re-up with the prescription drug plan you have, only to find out that a very important brand name drug that you take is no longer available, and now you're going to hit with $3,000 extra in medication costs this year because you didn't take the opportunity to give me a call and sit down and make sure that the plans you have are the plans you need. If you're just now turning 65, now's also a great time to jump in, make sure you understand the coverages, get the right elections, and get yourself taken care of going forward for the next 25, 30 years of hopefully long life. Give me a call here at Market Medicare Market Medicare Advisors at 316-252-8707. That's Market Medicare Advisors at 316-252-8707. Thanks for listening, and you have a great day.